About Aptos, so I will not stop on the movie of the Aptos, and we have 5 minutes movie about this, how Aptos was created and so on. But let me briefly explain you the history of the Aptos. Everything started in 1996 when Dr. Marlen Sulamanidze invented, let's say like this, the first threads which were lately used for aesthetic reasons. And he was the first one who used the threads with the bars in aesthetic procedures. Of course, those threads and methods lately were improved by his sons, Dr. George Sulamanidze, who is the general director of the Aptos company, and Dr. Constantin Sulamanidze, who is also the general director of the clinic of Total Charm. So they have also some improvement. They have also some input in improvement of the threads and the techniques, and also in an invention of some new products, for example, like needle to G and thread to G blunt and excellence visage with hyaluronic acid. This is already the work of his sons, Dr. Marlen's sons, Dr. George and Dr. Constantin Sulamanidze. And what about the thread lifting in general? Let me make a small introduction to thread lifting. I'm pretty sure that all of you are more or less already experienced with threads. You have some experience, but of course there are a lot of threads, different types, different structure. So all of them have different specifications. So that is why we are today here to go more in the details. But where does the name, from where the name Aptos derives from? This is two Greek words, of combination of two Greek words. This is anti and ptosis. So Aptos is the combination of those two Greek words, anti-ptosis, because everything that is related to Aptos is against the gravitational ptosis, which happens against the gravitational ptosis, which happens during the aging process, you know, right? So you already know from where the name Aptos derives from, but where exactly the thread lifting is located on this big, let's say, field of aesthetic market. You know, the corrective dermatology and aesthetic surgery, right? The corrective dermatology is mostly on the level of injectables, and aesthetic surgery, you know, this is the surgery. But the threads, in majority of the cases, is in between corrective dermatology and aesthetic surgery. So this is mini-invasive procedure, mostly with the local anesthesia. So that is why the thread lifting is, let's say, kind of link between a corrective dermatology and aesthetic surgery. And right now on aesthetic market, we have a lot of different threads. They are different by types, they are different by materials, they are different by application, they're different by thread structure, and they are different by effect. That's why I always say that if some of doctors or me, we have experience in one type of threads, it doesn't mean that this experience will be helpful with the another type of the threads. Let's say the main point of all of the threads is that majority of the cases are used in a subcutaneous fat layer, okay? But by type, they can be absorbable and non-absorbable. By type, threads can be also on PDO, polydioxanone material, polylactic acid, or combination with the caprolactone, silicone, gold, plastic, you know, silk, and even the nylon as well. But the thing is that of course, their effectiveness depends on the material, what kind of material is included in thread structure. For example, in case of Aptos, we have combination of the polylactic acid with caprolactone and hyaluronic acid. We don't have any other material for absorbable threads, but for non-absorbable threads, we have polypropylene, which is used in a surgery more than 50 years already. And you know that this is quite safe product, not regretted by organisms and so on, but rejected by organisms and so on. But the thing is that a non-absorbable thread, our Aptos non-absorbable threads, are used really in a very rare cases. Only in case of surgery, in a combination with the surgery, or in a case of patients with facial nerve paralysis. But in other cases, we are using absorbable threads, combination of polylactic acid, caprolactone, and sometimes with hyaluronic acid. The threads can be different by application, as I told you. This is needles, they can be on the needles, or they can be on the cannulas as well. So we have both types of threads, of Aptos threads, on the needles and on the cannulas as well. By thread structure, they can be smooth, more Nano threads, barbed threads, twisted threads, and screw threads. We have also Aptos threads. They are different by structure as well, because we have barbed threads, we have spring threads, we have spring type structured threads, screw, and so on. By effect, you know that threads can be with rejuvenation effect, armoring effect, and lifting effect as well. Or in some cases, some threads, they have all these effects as well. I will not stop on here, and this is the slide showing you exactly where the mini-invasive procedures are located. This is mini-invasive procedure. This is fat transfer and thread lifting, and they're in between. Let's say, for example, mass facelift and chemical peels, Botox, and so on. So in between the corrective dermatology and the plastic surgery. But what about the anatomy of the face in direction of the thread lifting? You know, the anatomy in both of the cases, I mean, the standard anatomy is the same in every kind of the patients, but there are some specifications we should take into account, and I will talk about this a bit later on the practical part. But what is here important, that the anatomy involved in the thread lifting, this is mostly subcutaneous fat layer. I say the Aptos, we never insert or implement the thread in the muscles. We never use threads in the skin or in dermis, never. Our layer for the thread lifting is only subcutaneous fat layer, and you know that we have different fat compartments on the face. They're separated from each other with septas, and in some cases those septas are exactly the fixing points for some threads in different zones and in different techniques. Okay, so what about those fat compartments? When we are working with the middle third of the face, you understand that the anatomy involved in this case is the middle cheek compartment. In case of also the nasolabial fold correction, you see that we have nasolabial compartment as well, and we are touching nasolabial compartment to stretch on the sides, right? For example, mandibular ligament is involved in a process when we correct the jowl and when we correct the facial oval. The platysmo-auricular ligament is used as a fixing point during the submental area treatment and so on. So this is more discussed on in details when we are talking on about the specific zones on the face or in general on the body. Just you to remember that they say why we don't use, for example, and there are a lot of experienced doctors. They are using the term that I inserted threads in the muscles, I inserted threads in the tissues. Okay, tissues can be right, but muscles never. Because why we don't use threads in the muscles? Because first of all, the most important thing is you to remember that inserting threads with the cannula or with the needle inside the muscle is dangerous, right? This is the very logical answer. The second one, why we don't use the threads in the muscles and in the deeper layers, because during the aging process, we have, the several stages of the aging process. The first, the aging process starts with the skin, then goes to dermis, and then goes to the subcutaneous fat layer. We receive the ptosis of those fat compartments, and the last stage of the aging process is, of course, the bony deformity, the bone deformation. So this is the last stage of the aging process, maybe after 80s, after the really very last stage. But the majority of the aging process happens, the longest period is exactly inside the subcutaneous fat layer, because it's from 35 approximately, starts from 40 till 60 approximately. And in this period exactly, we receive the ptosis of those fat compartments. We do not receive the ptosis of the muscles, but we receive the ptosis of those fat compartments, because we receive the weakening of the ligaments here. They're weakened, and those fat compartments go down and down. And also we receive the absorption of the fat compartment, I mean the fats inside the tissues, and we receive the less and less, let's say, puffy compartments. They are not the puffy that they were in a younger ages. So that's why our aim with the thread is, first of all, to recollect all those ptosis tissues on this anatomical location, and the second one is to give a volume to those fat compartments in a age period. Okay, this is what exactly I was talking about. You see here the younger patient, and on the right side you see the older patient. You see that on the aging phase we received not only the ptosis of the subcutaneous fat compartment, but also the absorption of the fat, and that's why the distance between those fat compartments are getting wider and wider. Okay, so that is why our aim with threads is to recollect, to bring them together again very near to each other, and to give volume and to fix them in its normal anatomical location. This is what exactly I was talking about by periods. Here you see, right, the young age, middle age, and already the aged patient. Of course, in those cases, when we have a totally extremely atonic phase with less fat, already, you know, after 60, 70, we can use also fat transfer in a combination with the thread lifting. This is quite a good combination. Why not? Okay. So, but in majority cases, if we receive quite good results with only thread lifting as well. The thing is that only you remember, and we should explain to our patients that threads will not replace fillers. They will not replace Botox. They will not replace surgery. This is very important to talk with them, because the threads have totally different group of the patient. Surgery has totally different group of the patient, and fillers, injectables as well. Of course, in some cases they can be done in a combination, but all of them, thread, surgery, and injectables, they have their different group of patients. And also threads are really effective from middle age till 50-55 approximately, in the end, in case of first and the second degree of ptosis. Of course, in other cases we are also using threads, like after 60, or in case of patients with the third and the fourth degree of ptosis, but we should explain to them that we will not receive that good result that we can receive with the middle-aged patients or with the younger patients. Okay, so also in case of aging patients, if we will use threads, we will receive quite good result, but it will need to be repeated after some period, especially approximately after 6-8 months. It's only in case of the aging patients. This kind of patients, if they are not ready for surgery, financially, psychologically, for general anesthesia, this kind of result to receive step by step is really very worthy for them. You know, some patients say, no, I don't want surgery. I want to receive step by step result with the threads. Let it be 2 years, let it be 3 years, step by step. Why not? Threads can do this step by step, of course, because on the first procedure, we are receiving the framing with the threads, I mean, with the fibrotical capsule inside tissues. Then we can combine them with the biorevitalization, with fillers as well, and step by step, it's getting better and better. Okay, but in middle-aged patients and in, younger patients, of course, we receive extremely good results with threads, and this is what I mean, that we should always make find the right candidates for thread lifting. And about the general principles of thread lifting, you know that in general, not only the Aptos, but in general, thread lifting has general principles, and one of them, the first one, is that most methods involve the implementation of threads in the direction opposite to aging vectors. What does it mean? For example, if we have different vectors of aging process on the face. For example, for the upper third, we have vertical direction of ptosis, and we receive like the vertical ptosis of the tissues. For the middle third of the face, we have a bit oblique direction. In this direction, we receive the ptosis of tissues. That is why we receive the nasolabial fold here, because the cheekbone cheekbone fat compartment has the oblique direction of aging process. It goes in the direction of the nasolabial fold, and because we receive the hanging of this tissue on the nasolabial fold, we receive the nasolabial fold, let's say the ductus like this, okay? But the same is for the jawline. We receive the ptosis of the jowal fat compartment, not in a vertical direction, not in this direction, but also a bit oblique direction. So that is why we should take into account all those vectors. It means if we know that here in these two zones we have oblique directions of the aging process, we should overcorrect the threads in opposite direction, not to damage the mimicry of the patient. The same is here for eyebrows. If you have a ptosis of the eyebrow, you will not make the correction on the side, right? You will make the direction opposite to the aging process. This is one of the principles of the aging process. And the second one is that the old threads should be inserted in subcutaneous fat area. We have 3 layers of subcutaneous fat. This is the deeper layer, middle layer of the subcutaneous area, and the superficial layer of the subcutaneous. But we can insert threads in all of these 3 layers of subcutaneous, but never beyond these 3 layers. Some threads are inserted a bit deeper to receive a volume, some in a deeper layer of subcutaneous fat tissue, some in the middle, and some of the threads superficially because they are supportive threads, and we need to make the correction of those superficial wrinkles. But what about the main fixation points? We don't have too much main fixing points. Why? Because we have grouped threads by middle third of the face, the lower third, the submental area, and the eyebrows. Okay, in most of the cases, this is the septus and those fibrotic tissues between the subcutaneous fat compartments. They work as a fixing point. It's a myth that somebody can, let's say, fix the thread in the ligaments, because you know, to find the ligament and to fix the threads with the ligament, you need to cut it, and you need to go deeper and to make a fixation and the sutures on the ligaments and so on. And this is not already the thread lifting, and this is not already the mini-invasive procedure. This is surgery. But if we are talking about the mini-invasive thread lifting, we always use, we do not use a surgical knife. Never. We are using the punctures, and from those entry points, we insert threads inside the tissues, 5, 6, 10, 11, or I don't know. So that is why here you see 5 main fixation points. Superior temporal septum is for the eyebrows. The orbicularis retaining ligament is also for the fixing of the eyebrows. Lateral cheek septum is all for all kind of threads used in the middle third of the face. And platysma auricular ligament, which is one of the most, let's say, effective fixing points, with my opinion, is used for treatments when we are making the correction of the submental area, and mandibular cutaneous ligament for the jawline as well. Okay, so those 5 main fixing points. So also we take into account the mimicry active zones, because, for example, in some zones like the nasolabial fold, the marionette lines, the lips, we cannot use threads which do not have the ability of stretching, because they can damage the mimicry. So that is why we have a very good option for those zones. We have threads with a spring structure. They have ability to stretch with the mimicry, and they are used in such kind of zones, like for the nasolabial folds, for the lips, and for marionette lines. So this is also one of the biggest benefits of the Aptos company and product, because those zones take into account the anatomy of the face as well. I see a lot of the procedures when they are inserting threads from, from the temporal area and going to the upper lip, and they're lifting it from the temporal area and so on. So I don't find it logically, because if you want to lift the marionette line and you insert it from the temporal area without a thread which do not have the stretching ability, and it means that patient with the mimicry, after 2-3 days, he or she will destroy this result. Okay, at least. The second problem can appear is that the patient will have problems with the mimicry as well. So that's why we have an extremely good option. Threads with a spring structure. They look like a spring, and they are inserted in this kind of zones, and patient doesn't have any problem with the mimicry. So they stretch with mimicry. About the dangerous zones, I will not talk here, because I will talk mostly about the practical part, but about dangerous zones, you know that the dangerous zones or the complications or the anatomy in general. This is the same what we have taught during the fillers, during the Botox, or during the surgery. All of you are practicing doctors, and you know all the dangerous zones. And in case of the thread lifting, the dangerous zones is the same like for the fillers or for the other treatments. But what is important here to remember that all those magistral vessels and nerves and the anatomical structures are deep beyond the subcutaneous fat layer. So it means that while we are working in subcutaneous fat layer, we are safe. Our patient is also safe. But as soon as you go deeper beyond the subcutaneous fat layer, and especially with the needles, of course you can damage some, for example, the parotid gland, or you can damage some vessels as well, or nerves as well. But to tell the truth, I am working in an education and training department, and I also receive the complications not only from Aptos procedures, but in general from other doctors using other threads as well. And to tell the truth, I have never received that even the less experienced doctor has damaged the gland duct or the nerves or the artery and so on. At least I didn't receive it during my 6 years, okay, here. Of course, you should be always very careful. If you are working in subcutaneous fat layer, you are safe, your patient is safe, and you do not touch the deeper anatomical structures, and you don't damage anything there. Okay, but what about also the sixth general principle of the thread lift is the biocompatibility. You know that we have two kinds of thread materials, three kinds. For non-absorbable is polypropylene, and you know that this is the surgical material, and it doesn't have any problems with the organism. The second one is the polylactic acid and caprolactone in a combination, and with hyaluronic acid as well. Regarding the polylactic acid and caprolactone, so why we use this combination? Because the thread absorption period inside tissues is approximately 1 year, polylactic acid. But if you combine it with caprolactone prolongs the thread absorption period inside tissues in a combination with polylactic acid. It means that it can become more than 1 year. It's approximately 1.5 years or 2 years with caprolactone. So caprolactone works as the material for prolongation of the polylactic acid absorption inside tissues. So we have 75% of polylactic acid inside our threads and 25% of caprolactone. Okay, so and here, if you see the histology on this slide, you will see that if even after 72 weeks, 41% of threads were still preserved inside tissues. 72 weeks, it's quite long period, and 41% is almost the half of the thread. So it means, depending on this, it means that our result is more or less more than the 72 weeks. Of course, this is the demonstrational histology we worked previously, but we have even new researches you can find on our Aptos global website. There are some articles regarding the histology and thread effectiveness and so on. So, and anytime you will have time, please look at those articles. So about the barb configuration, as I told you, most of our threads are barbed threads. And previously we had the old configuration of the barbs, and you see that this is the, let's say, direct cut from the body of the thread. But with the new configuration, we have a bit, let's say, the oblique cut of the barb from the body of the thread. And if you will pay attention, we receive two attachment points on the barb. Now you will see it. One is on the top of the barb, and the second attachment point is so called the belly of the barb. You will see it. You see, now we receive two angles, the top of the barb and the belly of the barb. Unlike the previous one, here you see that we have only one attachment point of the barb inside the tissues. This is only the top of the barb. Okay, but later we'll talk about the other threads as well, which are the spring structure thread and the screw threads as well, bidirectional threads and so on. Now, let me move to products and methods. Of course, I will now briefly explain you, not briefly, but I will explain you the characteristics of those products. And lately, you will receive more information with the catalogs from our distributor. And lately, we will have other trainings on site or online, and you will be getting more in the details on separate products. But let me show you the lines of the threads. Then we have a line called Excellence, which includes the Visage threads. We have the line for body. We have for Nano methods and light lift line as well. Today we will discuss two threads. This is two lines. This is the Excellence line and Nano line. So, but to tell the truth, there is not really very important for you to remember the lines of the thread, because you always remember only the name of the product, and this is enough. This is my experience, of course. Of course, if you will know the lines as well, it's perfect. But to tell the truth, it's not really that important. Okay. But the first product, our best seller, this is Excellence Visage. This is the most popular thread, the most effective thread, the thread with the ability to have a so-called full facelift with one session. And this is Excellence Visage. And here I want to tell you as well that we do not sell threads by amount, because this is a product created by doctors. So each box includes a specific amount of threads. That means that those threads are enough for different treatments, and you don't need to count them one by one to say, oh, for jawline you need 2, for nose you need 3, and so on. You have a package, you open 10 threads, 5 threads per each side, 5 threads another. So the company sells technique, and this technique already includes the specific amount of threads inside. Excellence Visage. This is the thread in the box with 10 threads inside one package, and 5 threads are separated for each side, 5 for left, 5 for right side. Each thread is preloaded inside the round tip cannula. So we have 10 cannulas with 10 threads inside, okay? Each thread is 19 centimeters long thread, 19. It means that if we will use threads from the zygomatic arch to the marionette lines, it's not 19 centimeters long, it's shorter. All face zones are shorter than 19 centimeters long thread. It means that with one 19 centimeters Excellence Visage thread, we will receive 2 entries, like one, and we will still have another half of the thread inside the cannula. So we can use it as a separate entry to the tissues. Let's say like this, 1 thread is equal to 2 threads on the face zones, okay? But it's separated inside tissues with a specific technique, and I will show you it on the video, and I will show you it I will explain it to you in a details today on my patient. It's more understandable on the live model. Of course, here I have also included some videos. So the uniqueness of this thread is that from one entry point, we are separating 5 threads, and with these 5 threads, we can lift the jawline, we can lift the marionette line, nasolabial fold, make a volume of the middle third of the face, or lifting of the cheekbone area, depending on the technique. So it means with 5 threads, we receive the full face lift of the lower jaw and the middle third of the face. Okay, so 10 pieces, as I told you, and package also includes 1 infiltration cannula for anesthesia and 18 gauge needle for making a puncture to go inside with the cannula, because those threads are preloaded inside round tip cannula, and round tip cannula do not have the possibility to penetrate the skin and to get inside the tissue. So that's why we need 18 gauge needle, right? But the benefit of this product, besides the effectiveness, is that the round tip cannula is extremely safe cannula. So all the time you will have. So Mariam, check it later. So yes, somebody needs. So yes, thank you. So it means that the round tip cannula will always avoid the anatomical structures, avoid the vessels, and we have less rehabilitation period. We have less bleeding and so on. Okay. So I think somebody is still talking, and it really disturbs us. So I think it's Dr. Hannah. Okay. Thank you. I muted it. Okay, I'm sorry. This is the effective product and plus safe product. Of course, if you will take this cannula and start to penetrate it on a purpose, the tissues, you will receive trauma. But in general, I mean, while working, it's a very safe product. Okay. The Visage Excellence Visage is not bi-directional thread, as we are already, as we see in most of the cases on aesthetic market. Excellence Visage is multi-directional thread, as you see on the upper photo. It means that each bar is located in an opposite direction to the next bar. So we receive the two bars in different directions, and on 1 centimeter of thread we have 6 like these barbs. Okay, unlike the bidirectional barbs, or like you see on the lower photo. In case of bidirectional threads, we have the barbs on the half of the thread in one direction, and on another half of the thread we have barbs in another direction, having a smooth part in the middle. So this is the bidirectional thread. But Excellence Visage is exactly like you see on the upper photo, and that is why this is unique threads and effective threads. Because if one of these Excellence Visage barbs will be suddenly damaged, you will have a guarantee that those threads will never migrate to the another zone on the face, or you will not receive the weakening of the thread, because you have barbs, other barbs in another direction, which fix them inside tissues properly. So what about the indications? Excellence Visage, as I told you, is universal thread. So mostly the indication is that when we have a patient with the lower jaw ptosis, the marionette lines, nasolabial folds, the patient which needs the volumization or the lifting of the middle third of the face, I mean the problems with the lower part and the middle part together in a combination. But mostly this is the patient with the first, second, and the third degree of ptosis, depending. In general, this is the second and the third degree of ptosis. We have only one entry point, and from one entry point, we introduce 5 threads with a fan technique from the lower jaw to the upper side. I will show you marking on the live patient. It's better to start to show it on my patient when I will move from here. But here is the video demonstration. This is the patient. Let me explain you with the first degree of ptosis. So that is why I used here for one entry point. I will discuss with you later how to find the entry point and how to mark patient. We make the anesthesia, then puncture with 18 gauge and with infiltrate anesthesia with the cannula. And only after this, we insert threads inside tissues. So this is the threads Excellence Visage. Soft version. This is shorter version. I will show you later after this demonstration. And we insert it inside tissues in a subcutaneous fat layer from one entry point. Okay, because this patient, she doesn't have too much of problems, too much of ptosis, and you see here right after result. Okay. But there is a big difference. You remember I told you that with Excellence Visage, you can either lift tissues or make a volumization. It depends on a technique. If you want to receive volumization of the middle third of the face, you should go in a deeper layers of the subcutaneous fat layer and you receive a volume. But if you want to receive only lifting, you are placing threads in the middle layer, like here. This animation is for volumization. We insert threads in deeper layers and we receive volume. The deeper layer of the subcutaneous is on the border with the SMAS, and how we reach them, how we reach the deeper layer of subcutaneous. We collect tissues between finger like this, and only in this position we insert threads inside tissues. So when you collect tissues like this, you lift subcutaneous fat layer and your thread goes in a deeper layer, so you receive volume. But if you want to make a lifting, you go in a middle layer, like you see here on the animation. You place threads in the middle layer of subcutaneous and you receive only the lifting without volumization. So how we reach the middle layer of the subcutaneous fat layer? We don't collect the tissues like this between finger. It means that we'll find the right way to the subcutaneous and go straightly in subcutaneous. You know how to reach the subcutaneous because most of you most probably are working with the fillers, and some of you may be in a surgery, so you know how to find the subcutaneous fat layer. Even when you make a puncture with 18 gauge needle, this is very specific feeling. You have a feeling that you fall down inside tissues. It means that you are already, you penetrated the skin, dermis, and you reach the subcutaneous fat layer. This lady, before and after Excellence Visage. Of course, she has heavy tissues and let's say not really very ideal candidate for Excellence Visage, but she has quite good results. She has quite good results for the jawline, for the marionette lines, only from 1 and 3 point. That's small enough volumization for the middle third of the face. Yeah. Here as well. This is before and immediately after the procedure. This lady, she doesn't has heavy tissues, but thin skin and asymmetry. Of course, asymmetry is the thing that can be corrected with the fillers and the surgery and or combination, the threads and the fillers as well. So this lady, she did only threads. So of course, we couldn't correct the asymmetry, but we gave her a bit of volume in the middle third of the face, and we corrected the marionette lines, nasolabial folds, and the skin structure and tone is getting better and better, as you see on the photo, because this is the patient after 6 months. And this lady, we told her that she is the patient for surgery, but I mean, she was very short of time because after 1 month, she had after 2 weeks, she had a wedding of her granddaughter. So I mean, she didn't have much time, and also she didn't have time and she was not ready financially and psychologically for facelift. For that is why she. That is why we decided to make for her the thread lifting, and she has extremely good results for this case, and this lady as well, before and after. This patient looks like ideal candidate to Excellence Visage, right? Now, Excellence Visage, but another variation. As I told you, the Excellence Visage is the multi-directional thread, but we have several variations. This is Excellence Visage Soft is the second product, and this is the totally same product as previous Excellence Visage, the multi-directional thread, polylactic acid with caprolactone, preloaded inside round tip cannula, 10 threads inside package, 5 threads per each side, everything is the same. The thing is that it's different from the previous one with the length, and this is 10 centimeters long thread. Visage Soft is 10 centimeters. The previous one was 19 centimeters. Why we need 10 centimeters long Excellence Visage Soft? Because this is for shorter faces, smaller faces, younger faces, for patients which has the beginning of ptosis, not too much heavy tissues, and so on. So this is an option for different category of the patient. Of course, you can use Excellence Visage from 1 and 3 points as the previous Excellence Visage, or from 2 and 3 points. 1 for the middle third of the face, for example, 3 threads for the middle third of the face, and 2 threads for the lower jaw. I will talk about the marking on our patient, and it depends if it's a classical Excellence Visage or Visage Soft, the entry point and the marking is the same. The difference is that they are for 2 different categories of the patients. And when we are talking about Excellence Visage, we don't forget that even the Excellence Visage Soft is the round inside the round tip cannula, and this is extremely safe product not to damage, the vessels, gland ducts, nerves, and so on. So here you see the demonstration of the Excellence Visage Soft for insertion inside the middle third of the face, right? This is how we insert it, and another thread would be inserted from second entry point, which is near the tragus. Of course, it's up to you how you will separate them. You can separate them, as I told you, insert them from 1 entry point or from 2 different entry points. It's up to you. There's nothing, different specific that why we need 2 entry points or why we need 1 entry point. This is upon experience, let's say, like this, when you want to separate one product for 2 different zones. Excellence Visage, we talked about Excellence Visage classic version and Excellence Visage soft, and as I told you, there are minimal differences between, there are a lot of similarities between them, and the difference is that the classical Visage and the Visage soft is used for different category of the patient. But what about the Nano Excellence threads? This is the third thread. The structure of those threads, Nano Excellence threads, is the same, multi-directional thread, and they're the same material and preloaded. They're 7 centimeters long thread and preloaded in blunt tip cannula, not round tip cannula like in case of Visage, but in a blunt tip cannula like you see now on the photo. Excellence with Nano Excellence is 7 centimeters, and the category of the patients mostly are those who want to make the volumization of the middle third of the face, the lifting of the eyebrow angles, and so on. So those threads are a bit supportive. They don't have, let's say the result, independent result, but in case you have a patient who wants to make the only volumization of the middle third of the face or lifting of the eyebrows, you can use Nano Excellence independently. But in general, they are used in a combination with Excellence Visage. Of course, Nano Excellence has different indications, and it will take us a lot of time to talk about all indications. But the zones you will use them most often is submental area, because in some we have patients, you know, with the beginning of ptosis in the submental area, with the skin tone structure decreasing. In those cases, we are using 5 threads per each side. For submental area, central fat compartment, for armoring, for framing, and for smaller lifting as well. Also, they're extremely good use for the middle third volumization. They're good in this case as well. And lately, I will try to show you a demonstration today on my patient. So this is the patient which was the Botox resistant. She didn't want to make the lifting of the eyebrow. She wanted with the Botox. So she wanted the very small changes for her eyebrow lifting. She just wanted to refresh her look. That is why we used Nano Excellence, because for stronger result, we have another thread called the needle 2G, and this is the subject mostly to advanced training, and we will teach you them later. So you see here, Nano Excellence, 7 centimeters long thread, okay, and before and immediately after result for eyebrow angle refreshment. So this is lady also Botox resistant, before and 10 days after, and here as well. So the previous 3 threads we talked about, classic Excellence Visage, Visage Soft, and Nano Excellence, they have similarities, that they are multi-directional threads, and their differences is that they are used for different category of the patients and for different indications. But what about the other threads? So let me introduce you now another product which is actually different by its structure than the other previous threads. This is a nano spring thread. They have a spring structure, that's why they are called the nano spring, and they are 7 centimeters long thread, and 5 pieces are included in one package, and mostly they are additional supportive threads. They are used mostly as a filament for the deeper wrinkles, for the nasolabial fold, for the forehead. We insert them exactly inside the wrinkle, and we receive the feeling of those wrinkles. They are good also for the marionette line lifting, for the nasolabial folds as well, and so on. In most of the cases, they have you will use those threads for smoker lines, because they correct this problem really very good. They're sometimes for lip contouring correction, and in general for the marionette lines lifting. Those threads are unique because they have a lifting effect, but they have ability to stretch with the mimicry, so they do not disturb patient and they do not damage mimicry. So this is how the nano spring looks like. This is the thread with the spring structure. As I told you, they are on the blunt tip cannula. It means that they have possibility to stretch, and this kind of cannula is also very safe. This is how we are using the threads for the lifting of the marionette lines from one entry point, the same entry point for Excellence Visage, and I will show you during the practical part. We are inserting 5-4 threads, depends, to lift the marionette lines. We correct it, we lift the marionette lines, and we receive, let's say, the lifting but not damage of the mimicry. In the middle third of the face, with those threads, we go a bit in a deeper layer of the subcutaneous, but as soon as we reach the marionette lines, we go in a superficial layer, and we receive the catching of the marionette line and fixing it, okay? So like this. This is the patient which received the treatment of the nasolabial fold with the nano spring and also the lifting of the marionette lines. As you see, quite good result for the nasolabial fold, the filling and the marionette line lifting. This lady as well, we use 2 nano springs per side. It depends. If you have deeper nasolabial fold, you use 3, 4, 5 nano springs. If it's superficial, you use 2 or 3 maximum, not more. This lady, we use 6 nano spring per each side, as you see here, and this is the same lady. Regarding nano Visage, we have 3 kind of threads in nano group. This is nano excellence, which is multi-directional thread, nano spring, which has a spring structure, and nano Visage thread. How differ nano Visage from previous threads? This is 2 twisted threads like this, and they're mostly used for the rejuvenation of the skin, small superficial wrinkles. They work as a filament for the forehead, for the horizontal neck wrinkles, and so on. They have possibility to untwist inside tissues after 1 week, so they push out the wrinkle and they work, as I told you, as a filament. They're extremely good used for the forehead, a static horizontal wrinkle, and for the neck horizontal wrinkles. In these cases, here you see before insertion and after insertion, they untwist inside tissues, and in these cases we are using those threads a bit superficially in between dermis, on the border of the dermis and subcutaneous fat layer. Why? Because we need to receive the result of pushing out the wrinkles, and this is where exactly they are placed, on the border of dermis and fatty tissue. So lady with a horizontal neck treatment. So you see we make a puncture with 18 gauge needle, and after this we insert nano Visage thread exactly inside the wrinkle, not deeper, not superficial. We are placing them exactly inside tissues. So like this. We put them exactly inside wrinkle. So also they are used quite good for periorbital hyperpigmentation treatment. You see here before and after 1 year, but this is totally different technique. Mostly we teach them on advanced techniques or during the professional techniques when we share with some tricks during this training. For palm rejuvenation as well, we insert them as a material for tissue treatment. Before I go to operating room, because they write me that patient is already ready, I want to tell that all our procedures are done with rules of asepsis and antisepsis. We proceed patient's face, we scrub our hands, we use sterile instruments, sterile sheets, and so on. So what are the, let's say, the side effects of the thread? This is pain, swelling, temporary asymmetry, but all of them are temporary, and they will, let's say, regulated after 4 or 5 days. And I will explain you to after treatment with the patient and about the recommendations as well. But let me talk about the combination of the threads with different products. This is the protocol. In case we want to treat the patient with the biorevitalization, it is always better to do it 2 weeks before. Of course, we can do it right after procedure, but better 2 weeks before. BTA injections 2 weeks before. Fillers can be done in the same treatment or before after 2-3 weeks after thread lifting. PRP can be done anytime. Chemical peels can be done on the same day of the procedure, and lasers 1 month before or 1 month after the procedure. So now I'm moving to my patient because she's already ready, and the other details of the marking and demonstration of the product I will do from the procedure room. So we'll meet you after 3-5 minutes. I'm going down to the operating room now. So see you soon.
So dear colleagues, our patient is 57 years old. Previously, 2 years ago, we have done threads here. It's much more, situation is much more better actually than previous time, but we need still a correction of the lower jaw, of the middle third of the face, nasolabial fold as well, the marionette lines as well. So this patient is ideal for Excellence Visage. In her case, we will use Excellence Visage with hyaluronic acid for full face, Nano spring threads 2 and 2 for the nasolabial fold wrinkle. Here you see it, right? And Nano Excellence thread for the submental area, because if you look at her like this, you will see that she has quite good, she doesn't have any ptosis tissues for the submental area, but she still has the beginning of ptosis, not beginning, but the ptosis of the skin here. It needs to be framed, and also it needs to be treated with the threads to stimulate the neocollagenesis, some fibrotic tissues inside, enough, right? So that is why we will use Nano Excellence threads here. So you remember that classic Excellence Visage with hyaluronic acid is 19 centimeters long thread that we will use for face. Nano Spring is 7 and is a spring structured thread that is used for the mimicry active areas, and Nano Excellence threads are the same like Excellence Visage, but shorter, 7 centimeters, and they will be used for the submental area. Let me show how we are how we find the marking points for Excellence Visage and for all kind of threads which are used in the middle third of the face. Okay, so right now we will use 5 threads of Excellence Visage from one entry point, and we will separate them with the fan technique from lower jaw to the middle third of the face. How to find the entry point? We draw the horizontal line from the lateral eye canthus to the top of the tragus, like this. Here, this is the horizontal. Horizontal line from lateral eye canthus to the top of the tragus, and on this horizontal line, near the beginning of the hairline, on zygoma arch here, we have entry point for Excellence Visage or for any threads used in the middle third of the face. We never use threads from the temporal area, never, because this is dangerous zones, very vascularized area, and we don't have any fixing points. Here we have a bone of the zygoma arch, so we will use 5 threads from here, from this entry point. 5 threads, but 1 entry point. So we draw first line, which goes to the lower jaw. 1 goes here. The second thread goes exactly to the lower jaw, fat compartment, which we have here. Yeah, this is the lower jaw fat compartment. The third goes to near to the mouth angle. The fourth goes to the middle part of the nasolabial fold. And fifth one goes to the upper part of the nasolabial fold. So this is how we separate 5 threads of excellence visage from one entry point. So we will receive lifting of the jawline, lifting of the marionette lines and the mouth angle, the lifting of the nasolabial, for stretching the nasolabial fold, and the lifting of the middle cheek fat compartment. But as I told you, excellence visage is 19 centimeters long thread. So this line is not 19, it's shorter. It means that with one thread, when we will insert the thread here, in this line, we will still have another half of the thread inside cannula. So we will reinsert another half of the same thread, like you see here, in between the previous and the future thread. So here. So this first line and this drop line is one thread inside one cannula, but inserted twice because we have quite long thread. The same will be done with the second thread here. The third thread here. The fourth thread here. And the fifth thread here. So with 5 threads per side, we will have approximately 10 entries, 10, 11 entries, because this zone is even shorter than this zone. Now, what about the nano spring threads, which we will use for filling the nasolabial fold wrinkles? So we will insert them here. And our entry point will be exactly from the beginning of the problem. Nano springs, they don't have any specific entry points, but the beginning of the problem is the beginning of the entry point. The same here. So we have the nasolabial fold starting from here. It means that we will insert them from here in this direction. We will use 2 threads of nano spring here. It will be enough to fill this kind of nasolabial fold. The same now on this side. Again, I draw the horizontal line from the lateral eye canthus to the top of the tragus here. And on the beginning of the hairline here on the zygoma bone, I have entry point for all kind of threads used for the middle third of the face. But now I'm using the excellence visage. Here, 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 and here. So it's 19 centimeters, as I told you. So it means that each thread will have another half, and they will be inserted in between the first and the next thread. Like this approximately. What about nano excellence? Nano excellence is 7 centimeters long thread, as I told you, and now here we will use for the submental area. How we find entry point for nano excellence in case we are using them for submental area? We are using them for central fat compartment, for preplatysmal fat. We are making the vertical line from the same lateral eye canthus to the lower jaw, like this, yeah. And on this vertical line, under the lower jaw here, we have entry point. Yeah? The same here. We have 5 threads. It means that we'll separate 5 threads with the fan technique. 1, crossing the medial line. 2, 3, 4, and 5. Like this. The same from another side. 1, 2, 3, 4, and 5. So we are crossing the medial line with those threads, yeah, in the most ptoset part. Okay. So we will proceed now the patient's face now. დაწეკით თავის ზემოთ ამომიწიეთ. მაქსიმალურად ზემოთ. ცოტა ამიწეთ თავი ამიწეთ. მე ამას გაგისწორებ, ჩა, დადა თავი. შეგიძლიათ დაამუშავა გამიმზადე და მე დავამუშავე. So we scrub our hands and we will start with the we start with the proceeding. ოპერაცია მიდის იქ. თიაგეთეს. ლოკალურად, ხო? ლოკალური მიდის. ტრენინგი, ხო? So we proceed our patient's face with betadine solution. Of course, in your case, it can be the other solution, but we use ცოტა საყურებს შეგიფერავთ. კი. კი. We can use we can use any of them, but we use betadine because it's colored and you always see which part is still not proceeded. We ask our patient not to touch face anymore after this proceeding. We do it from center to periphery. We proceed the visible part of the hair from the head as well, because the threads are long and anytime we can touch non-sterile hair or head. So it means that we can receive an infection. So we need to be very careful. Some doctors, some companies, they don't think that this is important to proceed patient's face. I don't agree with them because the thread lifting is mini-invasive procedures, but still invasive. So that is why we need to proceed the whole intervention area. Глеб, что-то сверху покажи мне, что-то ты снизу показываешь. Шею я потом. Да, я к концу. Я скажу тебе, хорошо? Надо вас. Туалергами хилот. Анестетик გამიზადე ვასა. თუ ჩერმოილოკოთ. Then we proceed ears as well. That's all. Now, sterile sheets for chest and for head. This is very important. Not only patient to use for patient to use sterile instruments, sterile sheets, but also doctor to be equipped with hat, with mask, and sterile gloves. თავი წამომიწეთ მარტო. დამიდეთ ახლა. We start with anesthesia. We use ultracaine solution, which is the group of articaine, and we dilute it is 1 milliliter of anesthetic solution. We dilute with 1 milliliter of sodium chloride because we don't need that strong anesthetic. So this is now 2 milliliters of anesthetic. It means that 1 milliliter is ultracaine already with epinephrine and 1 milliliter with sodium chloride. Now we will make the entry points for Excellence Visage, for Nano Spring, and for Nano Excellence. So here we are. I make like this 1 point of entry for entry point or for Nano Spring. Nano Spring I will make with needle, the anesthesia. The Visage I will make with infiltration cannula. And 1 entry point, and 1 entry point for Nano Excellence threads. Then we make a puncture. Подожди, ну тогда чуть-чуть отодвинь, а то я, видишь, что... Не, я... Ладно, ставь как хочешь. And entry anesthesia for entry points on left side. For Excellence Visage here, 1. For Nano Spring, 1. So. And for Nano Excellence. We make puncture now for Excellence Visage. And for Nano Excellence. We make puncture parallel to the skin, and we enter just subcutaneous fat layer. Now we continue with the anesthesia, with infiltration anesthesia of the subcutaneous fat layer here on the cannula. I start step by step, 5 lines only. 1, the second line, 2, 3, and here we have 4th line and 5th line. That's all. 2 milliliters of diluted anesthetic solution is enough. Now for the submental area, I will reach the left side from this entry point because this is shorter area. 1, 2, I change direction as you see. 4 and 5. That's all. Now moving to the left side, I will add a bit of anesthetic from this side as well to the submental area to make a tunnel. We don't use too much of anesthetic solutions. That's why it's diluted one, because we don't need to create too much of swelling. Here, 1, 2, 3, 4, 5 line, you see, right? So I'm moving to the lower part. Here I am. 2, 3, 4. That's all. We finished with anesthesia. ჩვენ მოვჭით უკვე ყველაზე უსიამოვნოს. მე უკვე აღარ გედგინებათ. всё, თავი აღარ გამიქანოთ და მე და ნანო ექსელენსი მომეცი. თავი უკან გადამიწიეთ. So, we will start with nano excellence. Камера так или? Я с нижней части начинаю. Хорошо, начну. So, this is nano excellence threads. As you see, the threads are multi-directional, the same like excellence visage, but inside the blunt tip cannula. This is safe cannula, of course, a bit sharp, but still it's not a needle. So we will use 5 these threads from 1 entry point, 1, 2, 3, 4, 5 with the fan technique. So the first of all, I insert it inside the subcutaneous fat layer from the same entry point where I've done already the anesthesia. So I will make one more again puncture with 18 gauge needle, a bit deeper. Okay, so we go inside the subcutaneous fat layer, first of all, like this, you see. We cross the medial line. We don't move superficial or deep. This is my line. Till the left side. Here I am, stretching to the sides, going back, and reinverting the tip inside tissues. Like this. That's all. The second thread, step by step, goes up and up. Okay, here I am, stretching tissues to the side. In this position, I remove cannula, and then when I reach the entry point, I leave a ½ centimeter inside and reinvert it. That's all. Now, the third thread goes a bit horizontally. I go back and I reinvert it again. კარგად ხართ? გავაგრძელო? So I try to catch all the zones from the neck angle till the lower jaw. And the last one, fifth one, will go here to create let's say, the contour of the lower jaw, the chin angle. Here I am, stretching on the side, going back and reinvert it inside. That's all. Now from the another side. Again, 5 threads, and they will crisscross with each other. Okay, right. Nano Excellency, Visage da Nano Spring. Here I am. Going back, stretching tissues on the side, and again, reinverting the tip of the thread. Why I reinvert the threads? Because I don't want to have the tips of the thread near to the entry point. Later, it can irritate the skin and cause, the infection if it come out and so on. So it's better to reinvert it. That's why I'm going several times inside, maximally to leave the thread inside the tissues. Все. The fourth one here. And the last one, the fifth one. Goes inside. Here I am. I stretch the tissues on the side like this. In this position, I remove cannula and again re-invert it inside. 1 and 2 maybe. Then I'm checking the tips of the thread not to be near the entry point, and that's all. I finished with the submental area. Okay, now I continue with Excellence Visage, the main product. So now Excellence Visage will be used from one entry point, as I told you, and 5 threads will be separated from the lower jaw till the middle third of the face. 1, 2, 3, 4, 5. We don't make a volume here, so that is why I go inside tissues in the middle layer of the subcutaneous, but do not collect the tissues between fingers, not to receive volume, just lifting effect. So the first thread, which I will insert here till here, all of them are 19 centimeters long thread, and it give why I used in her case, because she has a 2nd degree of ptosis, and I need the maximal elevation and the lifting of the full face from both of the from lower side and from the middle third of the face. And in her case, we will receive quite good result. Okay, so we'll wait just 1 minute, and I will continue with Excellence Visage hyaluronic acid. I already asked my colleagues to use that we will use here with hyaluronic acid the version, because we'll have less rehabilitation period. Lady is also a smoker, and she needs also her skin structure and tone to be improved. Okay, so that is why our choice felt on Excellence Visage classic version, the hyaluronic acid version. Okay. So that's not good. Okay, so Excellence Visage, 19 centimeters long thread on a round tip cannula, 19 centimeters. Okay, so this is what I've told you, that you see from this entry point, lower jaw, this cannula is quite long. So it means that we will use thread twice inside the tissues. So here like this. First of all, I go inside subcutaneous fat layer, 1, and I'm going till the lower jaw. I continue. You see? This is my layer, not deeper, not superficial. I reached lower jaw, here I am. Then I lift tissues maximally up, then remove a cannula. Then I leave approximately ½ centimeter, change my direction like this, and insert another half of the thread, which is still inside the cannula, a bit in an upper line. And here I am. Lifting and again inserting. Why I go several times? Because I want to leave all the thread inside tissues. the second one goes with the fan technique a bit upper than the previous one. Here I am near the jowl fat compartment. You see here I am, yeah. I lift tissues in a lifted position. I remove cannula, leave a small part of the thread inside, cannula inside, turn my direction and go ahead in another line. And again, I will just go inside twice or fourth just to leave all the thread inside tissues, checking the tip of the thread. This is the third one, which goes near the mouth angle. Here I am. I don't cross nasolabial fold. I lift tissues. I go back. And then I continue a bit up. So you understand why I go twice inside, because I want to leave the whole thread inside tissues, like this. The fourth one goes in the middle part of the nasolabial fold. Here I am. I go back and I go twice inside, or maybe third time inside, fourth time, because I want to lock tissues and fix them in a lifted position. I'd never cross the nasolabial fold because patient will damage the result. So it's better to stop on the septa of the nasolabial fold and to fix it in this location. And the last one, we never insert the last thread in the soft tissues of the periorbital area. So that's why our location is zygoma bone, and other parts of the threads, we are step by step separating, inserting to the other parts of the face. I inserted here 1, 2, 3, 4, 5, because I had still the thread inside tissues. Okay, now the nano spring threads for this side and for the nasolabial fold, I make a small puncture. Because I need how the nano spring looks like. This is the 7 centimeters long spring structure thread attached on the cannula, and we need to activate it. How we activate it? We take the tip of the thread, we turn several times clockwise, like this, and then against clockwise, and we unlock it on the cannula. This is the spring thread. We open it till the end, then we check and we see if the thread is moving on the cannula. Okay? So it means that we already unlocked thread and we can now insert it exactly inside tissues. We are inserting inside the nasolabial fold. Co там агла? Можешь чуть-чуть? Вот что, а то я толкаю и мне тоже самому неудобно. Спасибо. Here we are, exactly inside the nasolabial fold, till the end. We are placing it till the end. Here we are. We placed it. Then we remove cannula like this. And then make a massage, because we want to fix the tissues in between the spring rolls. Again, we open it. And then turn again clockwise. The second one, why? Because we need to make more filling of the wrinkles. I think 2 will be enough. We're leaving it like this and removing the wall cannula. Then massage, because we want to fix the tissues in between those spring rolls. Okay, then we take scissors and cutting the tips of those threads step by step. 1, 2. That's all. Now we are moving on the left side with Excellence Visage. Gleb, come. Here we are. This is subcutaneous fat layer, not deep, not superficial. I am till here, till the lower jaw, lifting maximally up tissues like this and removing cannula, leaving the small part of the cannula inside, change direction, and again, reinvert another half of the thread in between the first line and the second line. Here I am. And going back and inserting it. The second one goes here and in between. Here I am, change my direction and continue on a bit upper line. The third line. Here I am. And going up and again. The fourth one, which goes to the middle part of the nasolabial fold. Here I am. And it's another half, which goes a bit up and again like this. And the fifth one, which goes on zygoma bone, but not in the soft tissues of the periorbital area. Here I am, going back and a bit down as well. That's all. If we still have the thread inside cannula, we check the hair, of course, not to be inside the entry point. And cut the tip. That's all. Checking the tips as well, and that's all. Now, nano spring. I again make the puncture with 18 gauge needle. Worked? What? So, because we need to be a bit superficial. The thread is already opened. Our colleague assistant already prepared it for us. I'm inserting it inside the nasolabial fold and removing it. Making a massage. Şimdiki Mehmet'e drenajı vites. Moment, bakrateli. We cut it. And we insert another nano spring thread here. Again, inside wrinkle, not deep, not too much superficial, but a bit superficial than previous Excellence Visage thread. And then we remove the cannula. And we cut it, Robert Hart. So we finished already our procedure. We've done 3 products: Nano Excellence for submental area, Nano Spring for the nasolabial folds, and Excellence Visage for face oval, for marionette lines, and for middle third of the face. We received quite good result. The patient is a bit swollen, of course, but this is normal. We ask our patient as a recommendation not to wash face for 2 days, to just proceed it with chlorhexidine, and not to drink the hot drinks like hot tea, hot coffee for today. To use ice packs for 24 hours. We don't prescribe antibiotics here because I mean the patient is not traveling to another city, another country. We do not have too much of hematomas. Very normal, very normal swelling, not too much. So that's why antibiotics are not needed. We will prescribe for patients, for example, Traumel gel to decrease the swelling, and ice packs for today for 24 hours. And also sport, in her case, most probably it's better to avoid sport for 2 weeks approximately, but depends on what kind. She can make a cardio, for example, it's not a problem. Sleeping on the back for 1 week approximately better. Okay. And the other thing is that she has to avoid hot baths and sauna for 2 weeks. Face massage is also, let's say, forbidden for 1 month, not to destroy our results. And in other case, patient is free in 15 minutes. She can go home after using the ice packs. Okay. So, dear colleagues, this was our procedure today. So in case you have any questions, you can ask me right now in the chat, or you can send questions to distributor and they will forward it to us later, or write me an email. So thank you very much.